start.
Good evening, everyone. My name is Dr. Ruchi. I am a founder and CEO of IIHD, the National Institute for Human Development, an enterprise committed for social impact. I'm pleased to have my colleague, Mr. Souvik Goswami, who's a co-moderator of this session. So, Souvik, would you like to introduce yourself before we start?
Yeah, thanks a lot, Ruchi. Hello, friends. This is Souvik Goswami, co-founder and group chief editor of APAC Digital News Network. It's a knowledge consulting and community building organization. We are focusing on creating an impact through our various offerings, through our knowledge portals, organizing virtual events and webinars, and also working closely with various ministries on development issues. I think today's talk will be of importance because we are celebrating the 74th Independence Day of India. And as Honorable Prime Minister today in his speech has spoken about the healthcare sector, especially National Digital Health Mission and all those things. And I think IISD and APAC have collaborated for this special dialogue, special debate on independent India, the healthcare spectrum, where it has come in last 70 years and what is the future. And I think whatever be the deliberations today will be very important because we have got public policy experts, we have got healthcare uh, companies with us, we have got startups with us, we have social reformers with us. So we'll get various perspectives from various stakeholders who can be touching upon 2-3 issues which Ruchi will tell elaborately in coming minutes or so. So with this, I hand over to Ruchi again.
Great. Thank you so much, Souvik. And it's again my privilege to welcome each one of you who are there, who are with us on this occasion of Independence Day, and welcome all of you on this debate. So before I think we go to the next level, I would like to first introduce our chief guest of this session, Dr. R.K. Srivastava, who is a former chairman and board of governors, Medical Council of India, and former Director General of Health Services, Ministry of Health and Family Welfare, Government of India. So we welcome you, Dr. Srivastava, here, and it's an honor to have you on board. Then I would like to introduce our panel, Dr. Damodar Bachani, who is again coming from Ministry of Health and Family Welfare. He has been more than 20 years in the ministry, handling various national programs. Then we have Mr. Mukul Bagga, who is a Managing Director of Medicom Healthcare Pharmaceutical Private Limited, Gurgaon. We have Dr. Ashish Joshi, who is a Senior Associate Dean Academic and Student Affairs, City University of New York. And then we have Mr. Vivek Joshi, who is the Director, Investment Advisor Limited, who is an alumni of IIM Ahmedabad. We have Dr. Raghu Basibonia, who is the Director Diagnostic Work in Elmer, based in India. We have two young buddies, Dr. Fareen Chaudhary, who is currently working in ICICI Insurance, and Dr. Nishad, who is from Tata Institute of Health and Tata Institute of Social Sciences, and he was working with Roche Pharma. So this is our panel, and we welcome all of you, and we are delighted to have you on board. I'm looking forward to our interactive debate. So with this introduction, since this is the Independence Day, I would like to request our team member Prabhakar, can you please play
पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Thank you so much. Happy Independence Day to all Indians who are there in our country as well as those who are outside country. Everyone and I have a proud moment today, and we all feel proud to be an Indian. With this, I now request Dr. Srivastava who can address us on this occasion. So, Dr. Srivastava can't hear us. So, can you just see Prabhakar? Dr. Srivastava cannot hear us. Prabhakar, can you please see that? Yeah.
We can hear him.
Ruchi, I'll suggest if you can just text Dr. Srivastava that he can start his speech,
I
even if
have
he
done
can.
that. I have done that. Sir, please start. So there's some technical error. Sorry about that. Dr. Srivastava cannot hear. Sir, you can start. Sir, we can hear you.
Okay, I
Sir,
can
we can
start.
hear you.
Thank you.
Sure, sir.
Fine. Thank you very much for inviting me for this webinar. I think this is a great day when we are on 15th August, and after having heard the speech of the Honorable Prime Minister today, where there were a lot of mentions about the health activities which he has prioritized, especially about the digital health mission. This is probably the right time when we should have a relook at where we stand today as far as our progress in the health sector is concerned. You know that India has gone through a phase of Millennium Development Goal, which ultimately translated into a Sustainable Development Goal, and thereafter it followed the very basic new national health policy somewhere in 2017, taking forward the various type of strategic directions which India has to pursue, as well as the plan of actions which are to be unfolded in coming time for achieving the targets under the goal 3 of SDG, and keeping in mind the Indian priorities as envisaged in the national health policy. If we try to look at where we stand today, according to the framework of assessment of our achievement, which are internally worked out as well as internationally directed, we find that India has made tremendous progress as far as achieving the target for SDG is concerned. But still, there are very many gap areas where re-energized action is required, particularly for TB and NCD. And we have to take a leap forward so that we can meet the targets over there. Now, having said that, let me try to take you back to the major health sector announcement which has been made by the Honorable Prime Minister today from the Red Fort. The first and the foremost announcement, which also translates to the health sector, is Atmanirbhar Bharat. If we look at Atmanirbhar Bharat, you will see that it translates to an Atmanirbhar health sector. And how we are going to achieve this Atmanirbhar health sector, which at present require a type of fast track engine to take leap forward, it is through the National Digital Health Mission. The technology integrations, the innovation integrations, and the artificial integration into the delivery of healthcare services is what is the theme of National Digital Health Mission. And added to it are the various declarations which has been made in the national education policy, where the human resource training for the health sector has also been enhanced with the help of using the online training facilities. And moreover, the next announcement which has been made today is laying down of the optical fibers up to the last village, so that you can have infrastructure for application of these technology for delivery of the healthcare services to the last mile. So from my side, the speech of Honorable Prime Minister today gives us enough platform to internally assess our capacity, work out our strategic direction towards achieving our reach to the last mile person by application of technology, by application of digital health, and this has to be done on the already forward movement which is taking place at the governmental level as well as at the technology level. Now we know that the basic framework of National Digital Health Mission as on today is moving around one health ID, one health record, telemedicine delivery of services, application of innovation and technologies, and immersion of various type of tools for teaching within the healthcare system for lifelong learning, for regular courses, for short-term courses, for a type of exit policy, and building up a type of hybrid technology enforced health and wellness center by using and integrating IoT, mobile health, e-health, and using e-pharmacy for drug dispensing, etc. So these are the various type of things on which health ministry is already working. It has developed good number of tools which are already in applications which use digital technology, and these tools are all e-solution based, and we know about e-hospital, Apna Aspatal, Sugam for the drugs, vaccine tracker, etc., which are already there. So with all these type of infrastructural facilities working in the digital health sector and an announcement of National Digital Health Mission ultimately trying to integrate into a Atmanirbhar health sector is something for which today we have to take a call for. And once we try to take a call for such type of massive mega action plan, government is doing their D, we have to do our doing. Government plans from top to down, and we have to work out from bottoms up. And if we try to work out from bottoms up, what is more relevant for us now are the innovative solutions which are emerging out from every village, from every block, from every primary healthcare facility, from every community health facilities by young persons. They are the innovations which are coming forward for making healthcare accessible. They are there for making healthcare affordable. They are making healthcare comfortable for the patients. They are making healthcare detecting various type of emergency ailment at the earliest in the normal surrounding. They are helping delivery of the drugs at the doorstep. They are making the diagnostic services within the reach of the ordinary patient. So a bottoms-up approach by integrating these innovations, that new startups, new type of dashboard, new type of platforms, which can help building up a hybrid type of comprehensive primary health care structure befitting to the various prescription which has been top loaded by the government within the comprehensive primary health care program. Later on, it will be integrated within the various type of digital health delivery system. So this is where we have to become very vocal for these local solutions. When I say very vocal for the local solution, what I mean is that the solutions which are coming out by application of technology and various type of solutions should be evidence based. They should be validated externally. They should be interoperable. They should be able to create clean data. They should be able to create large data. They should be able to create easy basis for application of artificial intelligence in bringing large number of solutions. Now, we have got approximately about, say, about 7-8 years at our disposal to gear up areas and targets where we are lagging behind, to speed up areas where we have been able to achieve very nicely, so that by the end of SDG, we are able to showcase that India can achieve the target well within the time. And if we play our game nicely and efficiently, we can achieve it even before the time. I think it requires participation. It requires alliance. It requires focused convergence. It requires breaking of silos and integrating things towards the product. And these are the things which are in happening. On one side, there is the BIRAC. Other side, there are ICMR. Then there are various type of translation systems which are available. Then there are various type of public-private partnerships which is happening. There are various type of global alliances which are coming up. So all these things put together within a very systematically organized delivery of the healthcare system, I am sure that India will be able to achieve our target. We have been able to work hard and show that our system, public health system, can make difference even during the period of COVID as well. We have been able to showcase that if we desire, we can move forward in a fast track manner. We can create a very good support system, say for example lab system, say for example online training programs for the frontline worker, which is coming forward nowadays for the COVID like situations. So we have got inherent capacity. Such type of webinars, such type of discussions, such type of interactions where young participants from the different sectors come together with the experts, the elderly, not so elderly, and the very young mind put together can bring out tremendous changes. And I hope they will all take care of the basic pathway which we require to work out. With these words, I would like to conclude. Thank you.
Thank you.
Thank you so much, Dr. Srivastav. It is a great, direction which you have given for us to conduct this debate. And I think the key highlight which he has given is that he is very confident about that SDG. India is going to achieve SDG by 2025 and 2030, which has been decided by the government. Second thing I think which he has highlighted for us is that there are certain initiatives which Government of India has taken. Even today, Prime Minister Modi has given direction and vision to us, Atma Bharat Abhiyan, or you can say self-reliant India. Vocal for local is a tagline which he has given to us. And now further, we are talking about local for global as well. So all these initiatives are giving us direction how we should go in the future. And somewhere our debate is focused on that. And this is like a kind of a beginning for us that we would like to brainstorm on what are the implementation challenges. Policy formulation and policy direction is the one part, whereas the second part comes is the direction of implementation. And that's where the key challenges always comes when we are talking about the country like India, where so much diversity is there. But somehow I think one more thing which I would also like to highlight, which Dr. Srivastav has mentioned, is about the alliance part, the partnership part. This is extremely, extremely important for all of us. That unless and until that partnership is not there, the synergies of actions are not there, we are not going to achieve our intended goal. So with these words, we would like to close this inaugural session and would like to move ahead on the on the debate part. So, Souvik, would you like to say a word of thanks to our chief guest before we move to next session?
Yes, thanks, Ruchi, and thanks to Dr. Srivastav that he has enlightened us and touched upon very important aspects of comprehensive healthcare policy. What is the future? What is the way ahead? And as you rightly mentioned, that he has also mentioned about the two, three perspectives: the public policy perspective, the tech perspective, and the implement part. And I think with this kind of enlightened vision and whatever we'll be discussing today, and I think he has set the tone for the further scope of discussion for the entire panel discussion. And we thank Dr. Srivastava for joining us and delivering the keynote address. And we move on to the panel discussion on Independent India, the healthcare today and healthcare for tomorrow. With this, I would like to move to Ashish Joshi. He's a senior associate dean of City University of New York. Uh, I have a question for him. It reminds me of a book called Love in the Time of Cholera. I can say that it was written by Marquez. I can say that we can talk about the innovation in the time of Corona. Why I'm saying this? Because at one hand we have the healthcare disruptions are happening. Started much before the Corona crisis loomed largely on us. But in Indian perspective, the healthcare startups, healthcare technology, healthcare innovation started taking off in the last 2 3 years. But then this Corona crisis has come up. And if we compare both Corona crisis in one hand and healthcare disruptions to technology innovation, where do you see that? Where do you see the new normal is heading towards in terms of healthcare perspective? Dr. Joshi.
Dr. Joshi, can you hear us?
Dr. Joshi?
Yeah, can you hear
we
me?
can hear you. Yeah, please. Yeah.
Okay. Yeah. First of all, a very happy Independence Day, and I am delighted to be part of all the esteemed guests out over here. I think on this very special day, I would say that the importance of, as you mentioned earlier, that the speech coming from the Honorable Prime Minister, but at the same time, also the presence of Dr. Srivastava at this platform, I think illustrates the political will and the government's the commitment towards the National Digital Health Mission, which is a very, very important thing. That is one. I think because we would not be having so optimism today unless there is the kind of a leadership commitment from the top. So I think that is one thing. But then, Ruchi, you illustrated very, very well that now how do we create an operationalization and implementation framework? So, Shavik, thank you so much for putting this question. I have a quote actually, which I always use. I say, obstruction is opportunity, innovation is struggle. And I think that stands true to the situation of what COVID-19 has interfaced with the new startups, which was happening and continue to happen in India. I don't know, but just to give you a brief, like I've been coming to India for the last 10 years and nearly almost every month. Believe me, except the time during the COVID starting March to now. I have always felt optimism, and I feel that there's a lot of talent, there's a lot of opportunity. And if you really look at it, I think the kind of, even if you look at, I just watched LinkedIn as a social media profile. Look at the youth of India, which is actually coming out and coming up with solutions which they never would have realized that they would have been able to do if they were in their day-to-day job. So I think I feel very optimistic. One, in terms of the talent, in terms of the innovative ideas, in terms of the policy commitment. But I would like to highlight some of the key things which one needs to take into consideration of how we really need to operationalize, or what are some of the key things which we need to take into account. The couple of words which I wrote when Dr. Srivastava was mentioning, he says that we need to have accessible and affordable and evidence-based solutions. There are three things which are very key because I interact with a lot of students. I think there is a very important need to have the right workforce. So I think I'll add a couple of other words. One is that we do need skilled employment. I think that is going to be very critical. So I think once we know that there's a national digital health mission, there is a kind of a broader elements to that, but we need to also make sure that there's a right skilled workforce to deliver that. The second component, I think, which is very, very important, is we need sustained, and sustainability is going to be key. So as a part of the SDGs, we talk about sustainable development goals, but then we also need to make sure that our sustained mentorship should be there, sustained evaluation should be there, sustained evidence. So we need to have some sustained iterative process into that. Uh, Another aspect which is very important, as Dr. Srivastava mentioned, and everybody on the panel knows, that India has a lot of diversity, and diversity could be in many ways. So I think we need to come up with solutions which are culturally, which are contextually relevant and tailored to the specific needs. I love the term vocal for local, and local for global, but I also sometimes use the word glocal, which means that we need to get the best of the best out there and be open and receptive to basically any ideation which is coming from anyone. I wouldn't say that age should be a barrier. I wouldn't say that education should be like somebody who is like person like me sitting in the US is going to be always right. No, I think we should be very open to ideation to the youth. But at the same time, in my interaction, I strongly feel that employment is also a very important factor. So if I really link all these things, I think I use a framework which I say like we need sustainability, we need multi-sectoral engagement, which means health cannot be improved unless you are working closely with the other ministries of education, urban cities. So you need to bring those ministries together. And once that mindset is there, I think that will also bring in interdisciplinary education. I think that where the national education policy comes in. So I think this is a very good, great step in terms of the policy making, but I think how do you really take it to the grassroots level? One thing I would really like to highlight here, if please, I don't know how much time, but I will just mention very specific.
I'll give you one more time, 1 minute, 1 more minute.
Yes, thank you so much, Rahul. Because I think we are talking a lot about technology, and we are talking about solutions, and we are talking about applications. I think we really need a skilled workforce in how to use this data that will help to define evidence-based innovations, which can then help the government in their informed policy making. I think that is the key. I think there is a model which says we have a top down, yes, we want to go bottom up, but I think there is a need to be a bridge which needs to work in coalition with the government and the grassroots together. Because if we just leave that the policymakers will come up with a policy and we expect that somebody on the ground will implement, I think there's a need for a middle out model. This middle out needs to be a bridge, which is a continuum feeder to ensuring that there is a way to evaluate that whatever we are actually promising or whatever we are hoping to aspire to achieve is getting into it. Lastly, I will take over here that SDGs, one very important goal is decent work and economic growth. And I think it will be very interesting to see that how National Digital Health Mission actually ties to creating a public health or informatics workforce, which basically is allowing the students to be prepared in such a way that they're not just becoming from the local context, but at the same time it is a global. I would always say that the world is so interconnected, so I think we need to look at it from multiple ends. So in all I say the national health policy, the national education policy, the national digital health mission, I think is a great opportunity for everybody, not just in India but beyond India, to contribute and to collaborate and to coordinate, but to make sure that it is very, very data driven, very, very evidence based, and very much open to ensuring that employment is a critical angle to that. I think India needs employment also. That is my take on it. Thank you very much.
Thanks, Dr. Anil Joshi, Dr. Ashish Joshi, for highlighting quite important part. I think Ruchi and other panelists will also support that whatever may be discussed, I think the policy part is there, implementation part is there. But if I take one part of that speech, I'll take one part, that is, he said the skilled workforce, and especially who will be managing those data. and getting the best practices together. It's not only about local for vocal, but the global. And because the global best practices also have to be incorporated, and there has to be a mechanism where these policies are implemented in efficient manner. We are talking about large amount of data. Who's going to manage that data? Do we have that skilled workforce? What will industry do? I think for that, we can have a perspective from Mr. Mukul Bagga. He's the Managing Director, Medicom Healthcare Pharmaceutical Private Limited. Mr. Mukul Bagga, welcome you. What will be your take what Dr. Ashish Joshi has said that in terms of skilled workforce, managing those data, you're running a company. So what's your take on that?
Right. Very happy Independence Day to everyone, and really a privilege to be part of this panel. I think COVID scenario has actually been a kind of a silver lining in the cloud, because it has brought a lot of focus to healthcare, which our country was lacking. As we all know, a lot of promises were made, policies were made, but not too much had happened in terms of public health spending. So it's great to see now that healthcare is getting political attention as well, and the digital health mission is one part of it. If we were to look at this, from a perspective of industry and addressing the specific question you had, I think more important than the skill set required behind data is a proper policy framework to support the data sharing and confidentiality, etc. So in 2018, the National Data Privacy Act was initiated, but has not been fully implemented. It is still out there, getting inputs from the industry before it is formalized. And I happen to be associated with one of the largest data healthcare analytic companies in India called THB. And one of the challenges which industry was facing, and they have been sharing with me very vocally, is that if that current policy in its current form and shape is implemented, it will mean that the industry will be completely suppressed in terms of how they will be able to play or participate or contribute on how this data can be utilized. So one of the suggestions which I used to hear from them is Europe has been on the forefront of enacting the most practical laws, or even I would say most stringent laws. So why doesn't the government just borrow a page from some of these good practices which have happened, make some cultural fine tuning, and then implement? So if I was to conclude that thought with you, I think the timely implementation of a data sharing policy would precede the skilling and other things, which I think the industry is waiting and watching for how this policy will evolve.
Very, very, very important part by Dr. Mukul Bagga on the data privacy part, and I think time has come that government should also come up with a comprehensive policy addressing the concerns raised by the industry. And I think, as Mr. Mukul was saying, that the skill and all those things will come later part. But I think, Mr. Mukul, it's a mix of all the things coming together and simultaneously implementing all these things. I think in
Yes.
last 3-4 years, the last 2-3 years, we can see a lot of things are happening. You take the example of Corona crisis. Whoever has thought that things will be done in a span of 3 days or 4 days in government ecosystem? We used to talk about red tape and everything, but Corona has proven that if there is a will, there is a way. It can be done in 7 days, 5 days.
Yep.
I think whatever you have said is very important in terms of data privacy law, and industry is waiting for that. And I think managing data and securing data and also securing the privacy will be of utmost importance from the government of the day. And I think IT Ministry, Minister of Electronics and IT and Health Ministry will all sit together and all will come with a comprehensive policy soon. With this, we'll move to a young path. What the startup ecosystem or the youth are thinking about the new normal in healthcare perspective. Can we have a perspective from Dr. Pershin Chaudhary? She's representing ICICI Lombard Insurance. Pershin, your take, but I'll request you to kindly limit it within 2 minutes.
Hello.
Yeah, hi, we can hear you. Yes.
Happy Independence Day. Let me start with that. Yeah, so we are talking about new normal in a present scenario. So basically, as I said, like I was listening to all my seniors, I can understand that there is a lot of take on from provider side. So basically, I wanted to look from as a customer side, from one who will be consuming all those things. So there will be a lot of health seeking behavior change in the population also. That is an important thing. Initially will be like the new normal will be going from more clinical thing. People will be giving more importance to primary care and primordial care. For them, changing in a lifestyle become an important part. Changing the food habits, then with now wearing mask, having gloves, like basic things, very basic things, which will be changing. So this is a part of behavioral change in the population, which we can see. I know the government have many initiatives working on behavior change of the population, and it is an important aspect for a public health. So that will be a new normal for today's population and for the future coming, where people coming up with more public health. There's one more thing would like to add to it, like as Ayushman Bharat coming in a picture, where health and wellness is being a primary place where people go for a health for a health for health their health thing. So for them, NCDs as a comorbidity of the COVID will become a place where they can go and have screening done, and wellness activities will become a new normal for in the future
Great. I
and
think,
now.
Farid, you have highlighted very good point, which is specific to health wellness centers and how we are going to work, deal with healthcare. Now, I think I would like to ask Dr. Bachani on this, which Dr. Srivastava has already shared that his views on SDG. So, as we know, the development agenda pre 2015 was mainly about economic approach, but now since 2015, our approach is social, economic, and environment. So, these three synergy is needed. Three kind of synergies are needed, and which is not possible unless and until partnership alliances are given due importance for it. And data for sure, I think it is not from the policy formulation perspective, but also from the implementation perspective. Data has been highlighted by other speakers as well. So what we have seen is that there are certain indicators which we have set for ourselves as a national indicators. We have seen tuberculosis and NCD. We are not able to see any improvement per se. So what's your take on this, that with this COVID, now going future, how we should handle this, how we should address this?
Thank you, Dr. Ruchi, and happy Independence Day to all panelists as well as audience. If you recall, we had Health for All by 2000. Then we had Millennium Development Goals 2015, and now we have Sustainable Development Goals 2030. Have we taken a look back and did we really achieve it? Did we learn from our mistakes? We neither reached those goals of Health for All by 2000 nor all the MDGs. Some are there, but not all the MDGs by 20. I am a little apprehensive about 2030 goals as well. And incidentally, I was one of the contributors to the national health policy. And now that I am out of government, I can look critically at it. I think we have missed a few things as well. And COVID has virtually exposed that particular limitation. See, we had integrated disease surveillance program since 2003. What impact did it make in identifying or controlling COVID in its early stages? It didn't. It is now expanding and fast expanding. We were talking about data. We had enough data. We didn't utilize them. Data generation is one thing, but use the data, particularly as Ashish said, at local level, that was missing. And now, if you even look at COVID experiences in the last few months, And the government of India was controlling the entire pandemic. We were doing quite good. Once it was decentralized to the states, it virtually was very good somewhere and not very good elsewhere. And this is going to continue. And that's one big thing in India. Health policy formulation, technical guidelines, all those are central. But when it comes to implementation, they are left to the states. And states leave it to the district, and district leave it to the further block level or PSC level. And that's where we lack. We have very good policies in the past also, even for national health policy 2 or 2017, or various national health programs, very well planned. But when it comes to execution, we virtually not succeed everywhere. There are several linings, some do very well. We hardly learn from each other. That's one missing. Second, if you look at the key targets that have been set by 2017, I was looking at SDG goals versus the key target of national health policy. There are a few missing things. For example, mental health is not part of any key health indicator. It talks about occupational safety, but they have forgotten about road safety. There's no indicator whether we are going to do it. It's a SDG goal, SDG target, but it is not there in the national health policy target. It hardly touches multi-sectoral approach. Again, SDGs cannot be seen in silo. Everything affects health. Health is like an outcome. So unless like our young lady was saying about the goals, the sort of local targets of what she was to talk about NCDs. Now, NCDs cannot be controlled by medication and diagnosis alone. You have to go beyond the sector, address what are the risk factors, and that action is to be taken outside the health sector, not by the health sector. So that thing is also missing. So I think we have to, we hope that this will be addressed in coming years. But I feel targets that have been set by us for the national health policy are very difficult to achieve. It's good that targets are challenging, and that is that they should not be very easy to achieve, but they are
Yeah.
tough and unless and experience like COVID virtually will throw us back by 1 year or so, maybe more. We don't know.
Yeah.
Lastly, I would
Great.
like to emphasize the need for human resources. And technologies like digital platforms can be taken as facilitators, catalysts. They cannot replace human resource face. Health has to have a human face, and unless we develop the capacity of our health workforce at all levels, the dreams will remain dreams. I will stop here. Thank you.
Yeah, great. I think there are two important aspects which you have highlighted. One is the utilization of data. Data, whatever is available that has not been properly utilized. That's the one part. And second part is about taking right talent, right young force to deliver those services. Now, in the era of technological innovation, do we have right talent? Do we have enough, skill set who can deliver that service, those services?
Or develop skills within the existing HR. I mean, we
Very
don't
good.
have to
Very
replace
good.
everybody.
Yeah. So now, from industry perspective, now, Dr. Raghu, if you can just highlight your perspective on what you look, when you look for talent outside, in healthcare industry, like which kind of a time when you take them on board in your industry.
Right. First of all, happy Independence Day to everyone, to all the panelists and all the viewers. Yes, I mean, I think a lot of very important points have been raised, and obviously certain apprehensions are also there on the execution part, which is all part of the journey. Now, coming to the specific answer to Ruchi's question about the talent and the human resources. In general, health, we all know that, it's if you look at the doctor population ratio, nurse population ratio, whatever you take, I mean, we are lagging very, very behind. But we know it. There's nothing new about it. But not only that, but at the same time, there is some kind of an imbalance. Now, if you look at the, let's say a particular profession in the healthcare, let it be a physicians, let it be a skilled diagnostic worker or anybody. But there is an imbalance because if you take a cities like Bangalore, Hyderabad, Chennai, or metro cities, you have plenty of those doctors. There's no depth of it. Actually, there's a lot of competition. The young doctors who are just graduated, they're unable to even get the senior residencies, right? That much of a concentration of healthcare providers are there. But just to go a little away from the main cities, now they don't even have a postgraduate to treat a specialized disease. So this is a very, I mean, this is nothing. This is a very simple observation. I'm sure you all know about it. But what is that we are going to do about it? That is the question here, right? Concentration of the healthcare professionals. Let it be any industry, doesn't matter whether it's a nurses or it's a physicians or a diagnostics or whatever you say. All concentrate on certain cities only. If I name 6, 7 cities, if I take away, rest of them will not have the ratio of even 1/10 of what we have. So now what is that we need to do? So the two things what I would suggest is there has to be incentivization for the people to move away from the big metro cities to little bit interior. That will not happen unless there is a very big incentive for the healthcare workers from anyone, from physician to diagnostics to anybody. So this is something government has to
So
create
Raghu,
a very good incentive.
I'm just want to have a further, probing question on this. The whole intent of diagnostic industry nowadays going on is early detection, as much as reach to the last mile and do early detection. So when you are going with that kind of objective and purpose, so do you think that you have right, systems available, you get right people who can deliver those kind of services on ground, who can whether it's in partnership with government or in partnership with the civil society organization or in partnership or with your own staff. So do you think that we have right kind of a youth available who can deliver these kind of services to the last?
No.
We're going to call, interested in to know more about the rural, semi-urban, tier 2, tier 3 cities, not about the metros and tier 1.
Absolutely. I think that's exactly the point I was trying to drive. That again, centered in certain so-called metro cities or so-called tier 1, tier 2 cities. We are talking about it. We do not. We don't even have a proper collection mechanism about giving the proper diagnostic, basic testing what we require. There is not even a collection mechanism. For example, I'll tell you, if I were to do a simple test to get a blood sample from interiors of, let's say, type 3, type 4 cities, it will take 3 days. And if it is a cold chain, it's even worse. So that shows that the infrastructure is also lacking, actually. So absolutely, we are all privileged to be in big cities to have those services.
Yeah. So, Vivek, would you highlight a little bit about tech part, like how these startups are working in the healthcare sector, particularly focusing on diagnostic? What kind of a scenario is going on in India?
Hi, happy Independence Day, everyone. See, the way I would look at it is for us to get anywhere near what we want to do in healthcare, we need to fulfill the requirements of availability, accessibility, affordability, and the action of medicines and healthcare. And at the core of this model would be what I call force multipliers and finance. Technology is one force multiplier. Linear thinking is not going to get us anywhere close to our goals. The resources are not there. So in terms of technology, we are seeing some very interesting applications. For example, in COVID, telemedicine has taken off. Almost 40 million new patients have entered into telemedicine, apart from doctors. And about 45 to 50% of these new patients are in non-metros. So telemedicine, thanks to COVID, is finally reaching a critical mass. The second areas in which we are seeing startups delivering solutions based on technology are diagnostics. For example, we recently saw a startup which essentially is able to deliver biomarkers based on urine sampling over long distances to doctors who can then diagnose various diseases out of it. We saw another startup which starts from blood sampling and essentially instrumentation which sort of predicts and forecasts diseases based on the blood samples. We see use of data and time series analysis in forecasting epilepsy fits. So these are the solutions. Given the huge resource gap, these are the kind of solutions which will be needed. Now the Prime Minister is saying that this fiber connectivity will reach all the villages. 5G has a big advantage of reducing latency. So between 5G and India is quite advanced in 5G network compared to what one would have otherwise thought so. We can quickly get into 5G. So essentially, technology is going to be one of the key force multipliers. One, and if there are startups and entrepreneurs out there, the one thing I would like to leave them with is that there is no shortage of finance. There is a lot of money waiting to fund entrepreneurs. The problem is entrepreneurs are not ready to receive the money. At a mega level, country level, we are badly short of resources. The Prime Minister mentioned a $1.5 trillion infrastructure outlay today. In healthcare, if you look at the infrastructure pipeline, we have about $26 billion lined up, and we don't know where that $26 billion will come from. I'm sure the government will have some plans. But to the entrepreneurs, be assured there's a lot of money for startups. And you just need to come up with your right innovation and right way of approaching.
Very true. I
Very
think,
interesting perspective
yes,
from, Ruchi, yeah. So very interesting perspective from Mr. Vivek Joshi. And I think all the startups and entrepreneurs who are doing their best to innovate, they'll be closely listening to what you have said, that there's a lot of money available. Is that startups are not taking, and startups should come out, and I think they have to come up with a viable plan, not about only idea, but how do you scale up those ideas and whether those ideas are convincing. So I think that's an important part. And we can have a perspective from Dr. Sheikh Nishan Ashraf from Tata Institute of Social Sciences, Mumbai. Dr. Nishan, what's your take on what Mr. Vivek has said, that a lot of things are happening, but money is there, but startups are not are not ready to take that money. Your take on that?
Good evening, everyone. Very privileged to be on this panel, and very happy Independence Day to everyone on the panel and whoever is listening. So yes, I totally agree to what Mr. Vivek has to say about startups not coming forward. There could be multiple reasons for it, which I feel is that one could be that there could be a lack of a clear-cut visibility on what is the problem, or what is the business case in the for which the solutioning has to be done. Could be one thing. Second is that there could be a lack of a bridging between the technology domain and the healthcare domain, that the languages may not be matching up. That could be one of the reasons. But from an entrepreneurial side, as a policy, we should also have something of a cushion that we can start early, we can experiment, and we can fail quickly, and that also will actually encourage a lot of startups to actually come forward and take the risk. Could be one of those reasons. But apart from that, I believe that personally, I believe that startups is a flourishing ground. Health has so many of these gaps that needs to be filled.
Failure in a startup is not considered a negative when an entrepreneur comes up to present, as long as they have learned their lessons out of it. I mean, it is a vast field by itself, but let me put it this way. I am associated with angel forums. We get international entrepreneurs presenting and Indian entrepreneurs presenting. Indian angels end up investing in American entrepreneurs simply because Indian entrepreneurs are not ready. So an entrepreneur has to learn to stand on his or her own feet. And that's something Indian entrepreneurs have to do.
I think, Vivek, what I have realized is, I have been part of Atal Innovation Mission, and what we have realized is that growth mindset of our youngsters. That's something which they are working upon. Like unless and until you have that right mindset to do entrepreneurship, to go for a startup and do innovation, I think that's the first step to work upon. And second, I think what I really like about what Nishant mentioned is about the gap part. The technology as well as the health care. These two are not somewhere matching. There's no platform where these two can match together and brainstorm what should be done. So probably these are the space where more efforts are needed. Uh, so I would like to a little bit hear from manufacturing hub perspective. Do you think that India will be a manufacturing hub for medical device? Can we become medical device manufacturing hub? So I think I should request Dr. Raghu to speak on this.
I think his audio is muted.
Yeah. Please go ahead.
Can you hear me?
Yes, please go ahead.
Okay. So currently 85 to 90% of our sophisticated medical devices are being imported. So this is the fact today. And when we talk about the medical devices, why we are unable to manufacture everything here? Why this kind of a dependency is there on the imports, and why we can't be self-reliant? There are a couple of points we need to understand. One is that certain components require, it's highly capital intensive. So that is where the manufacturers, they are the diagnostic equipment manufacturers here in India, they would be apprehensive about the recovering those investments in a given time. So this is where you require a big push in certain component import. For example, certain components are easy to import, than with the GST that become more expensive actually. So that's why they are encouraged to import more than the manufacturer. Number one. Number two, certain components require capital intensive. So that's where your government has to help. So if you can identify, if you can rationalize certain components, import at a taxation level, and encourage at a government level supply of certain components, at least 50% of the devices we can manufacture. So these are the certain basics. That is the reason. Now today we are importing roughly about how much? 4,560 crores rupees from China. These are all components. These are not instruments, these are components. So what happens is ultimately we import and we assemble. So if we can take care of these components in various taxation-wise and bulk manufacturing-wise, then we can be self-sufficient in a given period of time. It will not happen overnight, because today we are almost 85 to 90 are being imported, percent is being imported. So if you take care of these steps, perhaps in a near future, we can be self-sufficient.
Great. So, Mukul, what do you think? What is your perspective on pharmaceutical? How pharmaceutical, the local pharmaceutical companies as well as or vis-a-vis multinational pharmaceutical companies, how they see these initiatives by Government of India and how they are looking for their future plan? What's their future plan on this?
Right. So I think we all recognize that India is the pharmacy of the world. So in terms of formulations, India contributes significantly to the world supply of pharmaceuticals. So there is no doubt about that. And just as an example, because vaccines are kind of topic of interest, 80% of the world's vaccine production is out of India. So wherever be the corona vaccine is created, ultimately it is going to find its manufacturing site in some shape or form in India. As we have heard, Serum Institute announced capacity of 2 billion doses, in their own current manufacturing facilities. But where you may say the bottlenecks are, and this has a lot of history and background in terms of how the industrial ecosystem evolved in respective countries, is where our dependence is on certain other countries in terms of raw materials, API, etc. And I think the current conflict, ongoing, stress, tension with China has clearly given us a push in that direction as well. Government is recognizing that perhaps we need to reduce that dependence and go back to being more self-dependent in terms of the pharmaceutical industry in India. So I would say that would be one sense that, in terms of the overall sector, parts of it are extremely, well grounded in India, parts of it we are a little vulnerable and we need to correct. If you look at it from a multinational perspective, and I can give you a couple of quick examples. I used to work for a company called Novartis, and they had a generics drug business, which is the largest generics drug company in the world, called Sandoz. It used to be part of Novartis earlier, and the entire and Sandoz had 5 manufacturing plants in India, but none of the Novartis products were sourced from any of the Novartis manufacturing plants in India. All the products which Novartis sold in India were manufactured by Indian pharmaceutical companies, and all the products manufactured at the Indian plants of Novartis, 5 plants, were exported because the cost of production was higher, because the quality requirements in certain global markets were slightly different, overheads were higher, whatever be the rationale. So the world is also looking at India as a great place to source high quality products in terms of what it is doing. So I think multinational companies also recognize this and are using India in that sense. But if I was to highlight the most crucial missing link on the pharmaceutical industry, we only talk of India being a manufacturing hub, and then we talk of compulsory licensing and all these things. What the people tend to forget is the pharmaceutical industry is an innovation-driven industry, R&D-driven industry. How many new pharmaceutical products have originated from India? If you look around you, not a single one. So that is the biggest missing link that we need to address, that the right policies in terms of right from the grassroots, the academic culture in terms of how innovation is respected, intellectual property is respected. Unless that is not built up from the grassroots, then that innovation culture will not happen, and India will not graduate in that value chain from just being a manufacturing hub to being a innovation and manufacturing hub.
It's very important. The thing I think Mr. Mukul has said that it's not about only becoming manufacturing hub, but also innovation hub. I think we can put a question to Mr. Vivek Joshi on this because Mr. Mukul has also touched upon the commerce part, the costing part of that. Uh, how do you perceive, Mr. Joshi, how the economics of healthcare will change in the post-COVID era, both in India and the world over? What's your take on that? And I think then Ruchi can sum up the entire discussion before we end that. So can we have a perspective from Mr. Vivek on the changing scope of economics in post-COVID era?
See, in terms of currently our per capita expenditure on healthcare is very low, at something like $70 per capita per year, and that was set to double by about 2025. Healthcare being such a vast area, it's difficult to put it under one umbrella straight. But coming to innovation, one of the reasons why, forget India, for 30 years, Singapore has not been able to deliver a single drug despite trying very hard. And that's because a drug can take anywhere from $500 million to $1.2 billion to develop and bring to market. So therefore, the high-end, the expensive drugs, we will continue to have to bring in from outside if required with compulsory licensing, etc. It is at the lower end or the medium end which is where we can do some degree of optimization. Now, remember, 70% of healthcare is delivered by the private sector, and that's not going to change significantly. The private sector is finally, in a sense, interested in profits, and currently hospitals are not making a great deal of profits, despite what people think. They're barely at 15% operating margin. And the more the government presses down on prices of drugs and prices of healthcare delivery, less is the incentive for the private sector to get involved, less is the incentive for entrepreneurs, and less is the incentive for venture capital to fund it. And venture capital looks for 25% IRR when they fund a project. So we have our middle class is expanding rapidly. Insurance, which is hardly 20% penetration in healthcare currently, if that, will have to step in a big way. I don't think, despite all the best intentions, the government will be able to go to 2.5, 3% of GDP in public healthcare expenditure, that room will not be available. So we will have to bank on insurance and low cost, which brings two aspects which I mentioned as force multipliers. One is we have to learn to use our network of Ayush doctors. There are 1 million+ doctors out there who are underutilized, and we are short of 2.6 million doctors in if we look at 2025. The second one is the diabetes capital of the world will have to focus a lot more on prevention. The government subsidizing sugar production and consumption in a country like India doesn't work out. So uh, I'm afraid that the healthcare expenditure as a percentage of household consumption is going to increase steadily. A lot more will depend on insurance. Indians are living longer. We will we already have more non-communicable lifestyle diseases than infectious diseases. So households will have to set aside more of their budgets for healthcare, uh, at least doubling by 2025, if not more. And health insurance currently loses money in the country, those who provide health insurance. So, and that's one of the reasons when you go to insurers, they never used to be very encouraging about giving you health insurance. So some model has to come up which allows health insurance companies also to make a reasonable amount of money. So I'm afraid it is the economics around healthcare which is going to derail any of our push towards SDG. The resources are not there. Our mindset towards healthcare is not there in place. And some of these things will have to change if you depend on the private sector.
Great.
Ruchi, mindset has to be changed for the development of health sector in India. Q for you.
Okay, great. I think in today's session, since Dr. Shivastav has given his inaugural speech and then having this debate session, what is coming up very clearly is the significance of data, which is coming very, very, prominently in this debate. That significance of data, the data use and data implications, and using it for policy implementation and further evaluation perspective. So that is something which is very much coming up. Second thing which is very important highlighted is the synergy between tech and the healthcare. The technology sector as well as the health sector should have a great synergy. More efforts are needed to improve this synergy if we have to move forward in this direction of SDG achievement of these goals. Third thing which is very important, that it doesn't matter whether you are a multinational company or a local company. The quality matters a lot, and the quality of the product or the solution. And quality comes when there are certain innovations which has been done, as per the need of the patient or the need of the future. So somewhere I think, irrespective of that, we need to focus on R&D part, innovations part, so that we can address the quality per se which is needed in the healthcare sector, both diagnostic as well as pharmaceutical. I think the last point which is very important is that though we are doing very good, reasonably good, say in SDG, and recent report of SDG, which is global level, has been released. It shows Southeast Asian countries are doing very good as far as the indicators are concerned. But somehow, the challenges remain in certain specific indicators, like as we mentioned about NCD, tuberculosis, and so on. So we need to have a specific targeted interventions to address those areas where support is needed at ground level. So with this, I think the bottom line which has emerged very clearly is that India is not the same as we were before. This 21st century has done a lot from policy perspective, from business perspective, as well as from tech perspective. So anything ordinary will not work here. We need to do something different, something innovative, something which makes us, unique in our journey. With this, I would like to thank everyone on this panel for giving your time, your experience, sharing your perspective. We are very happy to be associated with you on this, and we would like to be associated in future as well. And we are not going to end this here. We want to start this as a process where we will become a kind of a platform where implementation, which everyone understands is an issue. We all should highlight those, what are the challenges of implementation at every aspect, and give those implementation action points to various stakeholders who are delivering in the healthcare value chain. So this is just a beginning for us. And I also want to thank Souvik, who agreed and who is very passionate on healthcare. And they have, and I think very few days, a couple of days before only, we decided to have this, debate, and we want to contribute in our own way on this Independence Day. So thank you so much to each and every, eminent.
And I will like to thank Ruchi and all the eminent panelists. I'll just give a small departing note, maybe of a minute, because I was playing the devil's advocate's role of telling everybody to finish in 3 minutes and 2 minutes. As Ruchi was saying, by summing up the entire discussion, that the new normal and everything, I think it's a famous thing that sometimes it takes centuries to change, sometimes it takes weeks to change. And Corona has forced all of us to change our mindset drastically. And I think healthcare will be of no exception. We have to think new ways in terms of policy making, in terms of implementation of those policies, and bridging those gaps, what was highlighted by Mr. Joshi and other eminent panelists. And just to take a cue from Ashish Joshi, I'd like to inform you, he stressed on the word local, not only local for vocal or global. And taking cue from you, Mr. Joshi, we'd like to inform you that APAC Digital News Network is organizing 2-day virtual local India healthcare conclave on 27th and 28th of August this month. Website is APAC Digital News Network /GIHC. GIHC stands for Global India Healthcare Conclave, and IIHD is also a partner there, and Ruchi is also a speaker there. And a lot of best of the minds will come in this 2 days forum, where we are also giving a platform to healthcare startups. We'll have a healthcare perspective, we'll have perspective from hospitals, we'll have perspective from global collaborations. Everything will be there in those 2 days. And I request all of you to join us there, and all the stakeholders who are watching this special dialogue today. And we'd also like to thank Ruchi and IIHD for conceiving this special dialogue, the Independent India, the healthcare story today, and where it goes tomorrow. So with this, I'd like to thank all of you for joining us today. Over to you, Ruchi. Thanks a lot.
Jai Hind.
Jai Hind.
Jai Hind. Okay, thank you so much.
Thank you.
So much.
Thanks.
Jai Hind.
Bye-bye.
Bye.
Thank you. Take care.
Namaskar.